Novel agents have revolutionized the management of CLL, particularly in the frontline setting where the quality of randomized controlled data is very high. But for patients who have progressive disease after exposure to their first targeted agent, the data around second targeted agent therapy is still somewhat limited. And that's particularly true for patients who have been exposed to covalent Bruton tyrosine kinase inhibitors, where currently the best data is around pirtobrutinib, which is shown to have a median progression-free survival of just over 19-20 months, as well as venetoclax monotherapy used continuously, which in a phase 1/2 trial, again has a median progression-free survival of approximately 2 years. But a question that was still open that we tried to answer with this study was, how effective is venetoclax-rituximab used in a time-limited fashion for patients who have been previously exposed to covalent Bruton tyrosine kinase inhibitors? And importantly, this subgroup was not well represented in the Murano study, where time-limited Ven-R was established as a standard of care for relapsed and refractory CLL. So what did we find? In a group of 47 patients, 32 of whom had received time-limited intention Ven-R after BTKi exposure, we found that the overall response rate and the complete remission rate were high, and that the median progression-free survival was about 26 months. So this therapy is active, comparable to pirtobrutinib or continuous venetoclax monotherapy. However, what we were surprised to find was that the treatment-free remissions were rare. With a median progression-free survival of about 26 months, that means that most patients are either progressing on therapy or shortly after completing that 24-month period of venetoclax treatment. And it calls into question how feasible time-limited therapy is in this context, and how likely it is that patients will have a durable time off treatment. It also seriously calls into question the possibility of retreatment in these patients, because without a significant time off therapy, it's hard to be optimistic about the potential for venetoclax retreatment.